Hi everyone, this is Dr. Balde, Dr. Alseni Balde here to discuss about this new disease, COVID-19. We know that this disease it's everywhere. It's all over New York and all over the world. And New York has become the new epicenter of the disease. So it's really a concern for all of us. So I would discuss few items about the disease, and so we can help each other take care of ourselves and prevent the spread of the disease. So what is COVID-19? It is a novel coronavirus disease. Coronaviruses are not new. They have been around since a long time. Most of the time, though, they cause mild respiratory illnesses, and usually we don't even take medicine. If you go for a consult, they will just tell you it's viral, so they don't even give you medicine because there's no medicine that works on those cases. Unfortunately, they had been mild, and the patient will get better without any intervention, without any treatment. But this case, this new disease, this new novel virus, coronavirus, COVID-19, is completely different because it's more virulent, cause severe disease, and very easy to transmit from person to person now, as we can see. So it's a viral illness that affects the respiratory system. It's transmitted through coughing, sneezing. If one person who's sick is in contact with the other people who are not sick, so those people not sick are more likely to get the disease because it's very contagious. And again, the contagion, the transmission is through coughing, sneezing, and or touching areas, spaces that have the droplets on them. When the sick person coughs or sneezes, those droplets falls onto a surface like a counter, a doorknob, or different other places. And if a person happens to touch those places and then touch their face, they can easily get the disease. So what are the symptoms of the disease? This disease is new. It started about 3 months ago. So all we know about this disease is within the past 3 months. But the first symptoms that people manifest when they got the disease initially were cough, fever, body aches. They feel very sick, very tired. But lately we have noticing that many other people can get different symptoms like digestive symptoms, such as nausea, vomiting, diarrhea. We even have seen some people who just have the symptoms of loss of appetite. They don't feel taste, and they have anosmia, meaning they don't smell things. So those sometimes, not all the time, sometimes they can be a manifestation at the beginning of the disease. So what should we do to avoid the spread of this disease? We all know that initially when the disease started overseas in China, Asia, and Europe, the main mean of protection is to avoid any contact with a person who recently come back to the United States from abroad. So we started telling them to self-isolate for 14 days at home, not to go to work, not to be in contact with the general population. But now the disease is here. The transmission is in the community, meaning from person to person. So we don't even know where it's coming from now. We don't know who is sick, who's not sick, who's transmitting the disease, who's not transmitting the disease. That's why we all need to take precaution, consider that everybody has the disease, and whether you're sick or not, you try to protect yourself. And what are those means of protection? First of all is personal hygiene. washing your hands constantly all day, multiple times with soap and water. This is the first mean of protection. Then if you have hand sanitizer, use them consistently all the time, and do an effort not to touch areas that are really, particularly when you're in public space. As I said before, doorknobs, counters, and any place where you think that may harbor the virus, because the virus can survive outside for some time, between hours and days. So again, the main mean of protection is really avoiding any contact with the virus to your respiratory system. Washing your hand, avoiding close contact with people. Right now, we know in New York, they advise all of us, all the population, to stay home to practice social distancing. Social distancing is when people really try to stay away from each other, from strangers. If you are within your family, it's most of the time it's okay if you're not sick, if nobody's sick. So social distancing is to stay home as much as you can, avoid going out if you don't have to, particularly if you are not an essential worker, meaning people who work in the healthcare field, pharmacies, doctors, nurses, home healthcare services. So if you're not an essential worker, they advise you to stay home as much as possible. And all of this is really to avoid being in contact with people who are sick. If a person is sick, they stay home. They are not going out to transmit the disease to other people. And if they are not sick, they stay home. They avoid going out and be in contact with people who are sick. So this will help them to preserve their health and to avoid being sick. So social distancing is very important. This is the main way, the main method of really breaking the cycle of the transmission of this disease. We have seen how the disease is spreading. It's really fast. Last week there were only few thousands of cases, but now we are, multiple, like 10 times, 20 times of the cases of last week. So it's really, really very contagious. And the main thing we can do to stop this transmission is to practice social distancing. We really need to do that. And in addition, doing personal hygiene. Now, if despite all of this, someone gets sick, what to do? They do advise the person to stay home. Stay home and don't go out, exposing other people, because again, most people who get sick from COVID-19 will get better by their own without any medicine. All they need to do most of the time is to stay home, drink plenty of water, eat, and give it time. Again, 80% or more than 80% of people who contact the disease will get better by their own without any treatment. But few people who are at increased risk, such as those people who have chronic disease, such as diabetes, hypertension, heart disease, cancer, immunocompromised people, they can get sicker than people who are healthy. So those people are at increased risk. Few of them will get admitted to the hospital, and fewer of them will be admitted to the ICU, the intensive care units. And because when the disease get worse, it affects the lower respiratory system, the lungs, and it makes it difficult for the sick person to breathe. And most of the time, they need supplemental oxygen. Some other time, they even need intubation and ventilation to assist them, to help them breathe and to stay alive until their bodies get rid of the virus. So stay home. again. If you are not sick, stay home, practice personal hygiene. And if someone is sick at home, the advice is for them to really stay aside as much as possible. If you have multiple rooms in the apartment, the sick person can stay in one room. And if there are more than one bathroom, the sick person can be affected to use one bathroom. And the sick person will need to isolate themselves as much as possible, and also clean after them using hand sanitizer, home sanitizer such as bleach in water, and clean the bathroom, clean the door, clean after them. Use different utensils in order to avoid contamination to other family members who are not sick. And if the disease get worse, because sometimes, as I said, it can get worse, you can call your doctor. The doctor will advise you about the course of action. If you have chronic disease and you take medicine, make sure you have refills. You have all your medicine. And if it get worse again, call your doctor. And get even worse, at that time you need to call 911. So you will be evaluated and maybe taken to the hospital. And if you need to be admitted, you'll be admitted, because at the hospital they will do the test. Now, be advised also that not everybody will get tested. Why? Because there's not enough supplies to do the test for everyone. So only people who are really very sick, who comes to the hospital, will need to be tested. And not even all of them will be tested. It will be a case by case. So that is the reason of, one more time, to stay home as much as possible, but be in contact with your primary care physician to receive advice and to be safe. Again, is there a cure for COVID-19? We've seen plenty of information in the social media talking about different home remedies and different way to treat or to prevent the virus, the disease. But as of now, the FDA has not approved any medicine. There is no approved medicine for COVID-19. People talk a lot about chloroquine, hydroxychloroquine, and zithromycin. But, the few studies that have been done over chloroquine are really small. They are not conclusive. Right now, the medicine is being used at the hospital for just compassionate care, just for compassionate use, because there is nothing else. All drugs that have been being tested are still under clinical trials. None has been officially approved for use with COVID-19. So again, the best way is prevention. The best way to stop the transmission of the disease is prevention, using the different techniques that I just talked about. Is there any vaccine? No, there is no vaccine. All vaccine candidates are under clinical trials again, and none of them has been approved so far. Hopefully within the next few months we'll have one vaccine, but so far there's no vaccine. So to conclude this video one more time, let's all of us apply social distancing. Stay home as much as possible. If you have to go out, avoid any contacts with strangers, because you don't know whether they are sick or not. Don't come close to people. Don't come closer to 6 feet. You need to leave at least 6 feet between you and other people, and make an effort. Personal hygiene is very, very important. Stay home, eat well, drink well, and be safe. Thank you for listening to this video. Dr. Balde, Dr. Alseni Balde, Medcare Plus in the Bronx, New York. Thank you.